Hi everyone, we are in Vadi Hospital today, one of the best hospitals in Istanbul, and we are going to implant Titan Coloplast. Our surgeon is Professor KADIOGLU. He is the highest volume implanter in Istanbul, in Turkey, and he's gonna implant Coloplast Titan. As always, he always chooses Coloplast Titan. This is the best prosthesis with lifetime warranty and FDA approval in the market. Don't forget it. Keep following
everybody. Today we are going to implant a Coloplast 3-piece in a patient after robotic radical prostatectomy. The patient is 72 years old and underwent radical prostatectomy with robotic surgery 2 years ago. And he had also, before the surgery, erectile dysfunction, and the erectile dysfunction became severe after the operation, and the PD-5 inhibitors and injection therapy did fail to achieve rigid erection for vaginal penetration. So therefore, we decided to do a 3-piece implant using Coloplast. And as you know, the Coloplast is one of the best implants for the use of the penile prosthesis. And we put the reservoir, because of the compromised paravesical space, in an alternative space, which is submuscular, below the rectus muscle. And also use a periscopic incision to perform the surgery. Coloplast has lifelong warranty and has also the advantage to choose the antibiotics in order to deep the reservoir. For this purpose, we are going to rinse the prosthesis in rifampicin and gentamicin solution. And then antibiotic prophylaxis, IV, we are going to use third generation cephalosporin, vancomycin, and also fluconazole as an antifungal agent.
Hocam hastayı bağlayayım mı?
So we do a periscopic incision. Now we are preparing the both corpora cavernosa. Gel sayın.
Evet hocam. Arkaya bağlı mı?
Arkayı bağlı. For 30 seconds at least in rifampicin and gentamicin solution. This is the advantage of the Coloplast. You can choose the antibiotic depending on need. If the patient has previous infection, which is not sensitive to rifampicin or gentamicin, then you can change the antibiotic based on the grown bacteria in urine. and we leave the prosthesis inflated for a couple of days in order to prevent leakage from the proper cavernosa. And also we put a drain in. We prefer to drain the space for a day because although some surgeons feel that there is no need for drainage, we put a suction draining and take the drain off next day. Also we put a catheter, urinary catheter in, which will be also removed the day after. And the patient will be using his device after 6 weeks. And he will be satisfied by approximately 99% with the prosthesis, and also the partner satisfaction is high, between 95 and 100%.
Today we finished our operation, Coloplast Titan implantation. Professor Dr. KADIOGLU, the highest volume implanter in Istanbul, finished his operation here. It was totally perfect, and we were together in Vadi, Istanbul. Keep following us.